I think we heard that it's important. It's important to have a support system, as well as having, the courage to ask for help and accept help from our last panelist. Here are some key takeaways that we've heard throughout the evening. From our lung cancer, we've heard that lung cancer is the #1 cause of cancer death in Canadian women, and that we can help to prevent this and by having a low-dose CT scan and screening every year. And CT scan is very quick and it's very painless. And also we've learned that the Ontario Lung Screening Program is available, and for women who are 55 to 74 who have smoked daily for over 20 years. And for breast cancer, the key is early diagnosis saves lives. And the opportunity to be familiar with their breast, looking for changes, making sure that if we see any changes such as skin change, lumps, please inform your family doctor or your primary care provider and have it checked out. We know that having a mammogram as a screening tool is very important. And we know that we've heard that the age is being lowered to 40 years. So that's definitely a very important news for women across Canada, because early screening equals early diagnosis and longevity, which will save lives. We've heard that eating healthy, exercising, building your support system, and taking someone with you when you're going to your appointments and advocate for yourself are important. Mental health. We know that mental health is stigmatized, especially in the Black community. And we've heard here tonight that it's important to have those conversations. It's important to ask for help and to accept help and look for support within our families or friends or community members, as well as to professional, and making sure that we take the time to take care of ourselves, whether it's through yoga, exercise, mindfulness therapy, or spirituality. We know that we have resources out there in the community to help us. So no matter where we live in Canada, the Peter Gilgan Centre, who is one of the partners in this session, is available to provide support. There is an Every Breast Count website that was built by Black Women for Black Women that is available. Visit us at Women's College Hospital.ca for more information about this program. And Rethink. For your voices matters at Rethink. If you're looking for information, you want to feel empowered and advocate for yourself, and learning what question to ask, and looking for virtual support tools, whether it's from programs, online booklets, or physical booklets, know that you're not alone and you can reach out to Rethink. And Rethink Network, as a Rethink Network, they do our professional peer support program, and they definitely provide ways to stay connected. And you can reach them through their social media accounts, which is listed on the screen, or at their website or email address. And you can reach them at their website at www.rethinkbreastcancer.com. The Olive Branch of Hope is here to provide us with information about knowing our family tree, knowing our family history from both our mother and our father's side, and how that impacts our health, and ensuring that we're aware that genetic testing is available to help us, and that will help us to take control of our health and to know more about our genes and the genes that affect our health. The Olive Branch of Hope, no matter where you are in Canada or the Caribbean, the Olive Branch of Hope is committed to making your breast cancer journey easier. And they can be reached through their social media account, through Twitter, Facebook, Instagram at the phone number listed 416-256-3155, or via their email address or their website at www.theolivebranch.ca. The Ontario Lung Cancer Screening Program promotes and prevent early detection of lung cancer in high-risk patient population by conducting short and non-invasive diagnostic exam, and we know that this is done through low-dose CT scan. To reach the Ontario Lung Cancer Screening Program, they can be reached at 416-340-4154 or at their website, www.uhn.ca/lung cancer screening. Or Canadian Cancer Society, if you're looking for information coast to coast across Canada, they can be reached and contacting the cancer information line. You can see the 1-800 number here, or you can go to cancer.ca. For local services in your own community, visit cancer.ca/CSL. If you want to get involved, whether you're you're a cancer survivor or you're a caregiver, you can reach out to the Canadian Cancer Society and look for information about their CCS advisory panel. And in closing, I just want to take the opportunity to thank you for joining us this year at our Best Health for Black Women event. I hope you enjoy the event and the opportunity to share this space with us. I'd like to once again thank our sponsors and our partners, the Olive Branch of Hope, the Peter Gilgan Center for Women's Cancers at Women's College Hospital, the Canadian Cancer Society, Rethink Breast Cancer, and the University Health Network. I'd also like to thank our panelists, our presenters, for sharing their knowledge, their insights, and experiences with us. Finally, my sincere thank you to the member of our planning committee, especially to our project manager, Patricia, who have worked so hard to make this event a success. I'm also pleased to share with you that this event has been recorded and will be shared via a link via the email address that you've used to register. I'll also encourage you to complete a post-event survey that will come out in the coming week, and we will definitely use this information to help us plan for meaningful and impactful events in the future. We hope you leave here tonight feeling more informed, empowered to take control of your health and to make choices that are right for you, and to access the resources and support that are out there to help us and enable you to better manage your health and to address any related illness or crisis that you may have. We look forward to seeing you next year at Best Health for Black Women. Thank you for joining us.